Tampa Bay Buccaneers wide receiver Mike Evans suffers a broken collarbone during a catch in the loss to the Lions last night. But is this the only injury that happened? If you look at the headline, you're going to think, okay, this is definitely the most significant injury that occurred, even if he had other stuff. And we're going to go look at the other injuries that he did sustain and talk about, is this really the one that should be highlighted or not? So, right, they're talking about because of the collarbone, he's going to be out the rest of the year. And then you see how they just kind of quickly sneak it in there, who also sustained a concussion. I don't know if you saw him after the play. He was down for a bit. Now, you could say he was down completely because of the pain from breaking the collarbone. That is very, very plausible. But he looked out of it. So he was either out of it because of the amount of pain, or he was out of it because of the fact that he did suffer a pretty good concussion. And it was clear even later when he was trying to walk back to the sidelines, he was just still out of it. Now, why do I have an issue with this article highlighting this suffers a broken collarbone? So, as someone who's treated concussions for well over a decade, I can tell you this. If someone has a broken bone or they get a tear in like their shoulder from, like, say, a car accident, their concussion is going to be ignored 9 out of 10 times. And they will continue with headaches and neck pain and brain fog and fatigue. And they will say, well, I mean, that's all very reasonable that it's from this broken collarbone or from their shoulder injury, because when you're in that much pain, it's going to impact how well you sleep. When you're not sleeping well, it's going to make you tired. It's going to make you foggy, but also because of the injury, it's going to cause all this tension on your neck. So it's going to cause headaches, which, don't get me wrong, is very, very plausible. And you can see how you can make this logical conclusion. But what about when you're wrong on that conclusion? And someone now gets through this collarbone injury 2 to 3 months later, or they get through their shoulder injury, right? Depending on what it was, 3 to 6 months down the road, and they're still not getting better. You have missed this giant window where they could have actually been recovering from their concussion, and they are not. Because when we look at these injuries, one of these injuries, the collarbone, it is a short-term injury, 2 to 3 months. It will basically be as if nothing ever happened. The risk of anything significant down the road just doesn't exist when we look at our collarbone injury. But when we look at a concussion, this is something that could impact him the rest of his life. We know it's linked to increased risk of any type of dementia, specifically Alzheimer's, but it also does increase dementia as a whole. It increases the likelihood of mental health issues, depression, anxiety, PTSD. What else do we know? It impacts likelihood of developing Parkinson's disease. And there's so many other things. There's nothing good that comes from concussions. And unfortunately, this is why people still don't consider concussions for what they truly are. And it's why 90% of my patients who are still dealing with concussion issues, they have no clue that's what they're dealing with. Because in the media, in sports, and all over the news, we are still downplaying the effects of a concussion. We're still putting it as second fiddle to injuries that are actually much less significant than a concussion. So I wanted to cover this because seeing stuff like this really annoys me, because the severe injury is downplayed. The minimal injury is upplayed because it's a broken bone. If you'd like to learn more about what we do here at Peak Brain and Body, please check out some of the other YouTube videos. Also, you can visit our website, peakbrainandbody.com. And if you'd like to work with me one-on-one, you can always request a health strategy consult. This is not a meet and greet. This is where I actually am starting to go through and starting to map out what the pieces of the puzzle are and what we need to do to help you get the results. So if you're looking for results, let us know.